Here we go.
Good afternoon. It is 4:01. I would like to call the special full board meeting of Muskegon County Board of Commissioners to order. Could I have a roll call, please, Madam Clerk?
Vice Chair Foster,
Here.
Commissioner Hovey Wright,
Here.
Chairman Hughes,
Here.
Commissioner Laring,
Here.
Commissioner Mahoney,
Here.
Commissioner Nash,
Here.
Commissioner Skolnick,
Excused.
Commissioner Snyder,
Here.
Commissioner Wilkins,
Excused.
7 present.
Thank you very much. And Commissioner Wilkins and Commissioner Skolnick may be a little late today. Next, I would like to have everyone stand for Pastor Tim Cross is going to offer a blessing, and we will move into the Pledge of Allegiance.
Father, we just come to you today, especially as this council and this committee is making decisions concerning some serious things in our nation, our state. And so, Father, I think, first of all, Psalm 46:1 says that you are an ever-present help in the difficult places of life. You're abundantly available to help. And, Father, your word says as well that if we lack wisdom, we can ask of the liberal giving God who will give it to us liberally. So, Father, I ask for wisdom to be given to this commission, to give them wisdom in the decisions that need to be made. Father, even the insight, not to overreact and not to underreact, but to act with the wisdom of God for our community. That, Father, even Jesus taught to pray, deliver us from the evil one. And we pray that you would deliver us, Father, just from the evil of this virus and even hysteria or fear. Father, I thank you that you've not given us a spirit of fear, but of power and of love and a sound mind. And even in your word, you said 365 times we're not to fear not. So, Father, I thank you for that. And you said in your word that whatever we bind on earth will be bound in heaven. Whatever we loose on earth will be loosed in heaven. Father, I pray for the peace of God to rest upon this commission, to rest upon these commissioners, and that, Father God, they would make decisions out of peace and out of wisdom. And, Father, I thank you for this. In Jesus' name, amen.
Amen. Commissioner Mahoney, would you lead the pledge?
Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Next on our board agenda is approval of the agenda, and I would like to add to that a motion to pay the accounts payable that will be coming up during our closure. That will be added to the agenda. Do I have a motion to approve the agenda?
So moved. Support.
Second.
By Commissioner Snyder, second by Commissioner Foster. Any comments, questions, or concerns? Seeing none, all those in favor, aye.
Aye.
All those opposed, the same. That motion is carried. Next on our agenda is public comment on an agenda item. Is there anyone that would like to?
Yes. Good evening. Tony Barnes, Dalton Township Supervisor. I am coming to you today as the president of the Muskegon County Chapter MTA. We are canceling our March 31st quarterly meeting. We did, in fact, make a call today to cancel the water policy meeting on the first Wednesday of April. I come to you today with this, I guess, a request if the county is going to take some measures with respect to closing for the coronavirus and to try to prevent the spread of that. Is there any direction for townships that you're going to bestow onto us? Because I have a lot of people asking throughout the county if we've heard anything. So I would hope that the county would at least give us some direction. I was just handed a letter from our public health director, Kathy Moore. We will take a look at this and see if that is sufficient for the municipalities moving forward. But we're looking for some direction today. So you're our county leaders, and if we can get some direction for the townships, that would be greatly appreciated today. Thank you.
Thank you, Supervisor Barnes. Is there any other public comment? Seeing none, we will move on. Committee and board reports, Community Development and Strategic Planning Committee.
Oh, what's up
Thank you, Madam Chair. The Community Development Strategic Planning Committee met on March 12th It was recommended, and I move CDSP 2003-02 and CDSP 2003-03.
Support.
We have a motion and support. Are there any comments, questions, or concerns? Seeing none, Madam Clerk, could I have a roll call, please?
Vice Chair Foster,
Yes.
Commissioner Hovey Wright,
Yes.
Commissioner Laring,
No on 02, yes on 03.
Commissioner Mahoney,
Yes.
Commissioner Nash,
Yes.
Commissioner Skolnick,
Yes.
Commissioner Snyder,
Yes.
Commissioner Wilkins,
Yes.
Chairman Hughes.
Yes.
That's 9 yes on 03 and 8 yes, 1 no on 02.
Thank you very much, and that motion carries.
Thank you, Madam Chair. That will conclude my report.
Thank you, Commissioner Nash. Next is Transportation. Commissioner Wilkins.
Thank you, Madam Chair. The Transportation Committee met on March 12, 2020. It was recommended, and I move TR 2003-02 through TR 2003-09.
Support.
We have a motion and support. Are there any comments, questions, or concerns on this motion? Commissioner Laring.
I have some questions. I thought that 08 was voted down in the board meeting,
Mhm.
and I'm not sure why it's on the agenda.
You're right,
it was.
It
That's
was
true.
voted
That
down.
was voted down.
Good catch.
08 will be removed from that. It will be 02, 3, 4, 5, 6, 7, and 9 we will be voting on. Are there any other questions, comments, concerns, or corrections?
Madam Chair, doesn't
Yes.
09 directly affect 08?
To table the motion due to lack of information until after the special directors meeting.
Which
that
would have
be,
been
yes,
today.
That's true. That would have been there.
That's what we decided yesterday, if
Okay.
I remember right.
Yep.
Till today.
All right. And we will be discussing that at a later time. So,
So it's 02 through 07.
Correct.
yeah, because we're going to be handling the other two today. So that'll be fine. 02 through 07. Any other questions, comments, or concerns? Seeing none, roll call, please.
Commissioner Hovey Wright,
Yes.
Commissioner Laring,
Yes.
Commissioner Mahoney,
Yes.
Commissioner Nash,
Yes.
Commissioner Skolnick,
Yes.
Commissioner Snyder,
Yes.
Commissioner Wilkins,
Yes.
Vice Chair Foster,
Yes.
Chairman Hughes.
Yes,
That's 9 yes.
and that motion carries. Thank you, Commissioner Wilkins. Next is the chairman's report. First of all, I would like to ask a request to pay the accounts payable while we are going to be closed. The accounts payable will be for $14,192,482.46. It is payable February 22nd through March 13th and February 1st through February 29th for P cards and EFT payments, and they are presented by the county clerk.
I will make that motion.
Support.
We have a motion and support. Are there any comments, questions, or concerns? Seeing none, roll call, please, Madam Clerk.
Commissioner Laring,
Yes.
Commissioner Mahoney,
Yes.
Commissioner Nash,
Yes.
Commissioner Skolnick,
Yes.
Commissioner Snyder,
Yes.
Commissioner Wilkins,
Yes.
Vice Chair Foster,
Yes.
Commissioner Hovey Wright,
Yes.
Chairman Hughes.
Yes,
9 yes.
thank you, and that motion carries. Do you want me to go over this first? All right, today, as you are aware, the reason that we held off for this meeting today was that we were waiting to meet with the department heads, the elected officials, and our emergency response people, and just about everybody in the county building, it seemed like. What we've done is we have, I have activated the emergency response plan, and we have sent this memorandum to the county employees. Muskegon County is following the state of Michigan's recommendation in preventing the spread of this COVID-19 coronavirus to protect the overall health of our citizens, family, and employees. Muskegon County is moving forward with the closure plan beginning Monday, March 16th, 2020. County offices will be closed March 16th through April 5th, 2020. Only designated essential staff will report as directed by department heads. Staff previously scheduled for vacation and/or sick time will be charged accordingly. All staff will be paid as if they were at work. However, non-essential staff must be available, engaged to work if they are requested. If you are available, you will be charged. If you are not available and you have already applied for vacation time, you will be charged the vacation time or sick time. And if you are not available to work if we call you in, you will also be charged with vacation or sick time. If you're canceling your scheduled vacation or sick time due to travel restrictions, please notify your department head today so we can take that into consideration. And all employee authorized travel is suspended while the state of Michigan remains in a state of emergency. All staff returning from international travel must contact Muskegon County Health Department or Public Health for further instructions prior to returning to work. All department directors, elected officials, and court administrators will be able to answer department-specific questions of employees, or you may contact the county administration offices. This was what we sent out to the employees today about 11:30. Those went out to all the employees. We also put out a press release released today, Muskegon County to close county offices. The county is moving forward with closing all offices beginning Monday, March 16th. This follows the governor's decision to close K through 12 schools and the executive order 2020-5 to cancel all events over 250 people and all assemblages in shared space over 250 people. Muskegon County Courthouse receives 500 to 2,000 people at any given day throughout the week. Executive leaders of Muskegon County met early this morning to decide what is best for our community and staff members. In support of Governor Whitmer's recommendation ending the spread of the COVID-19 coronavirus, we have decided to close county offices in order to protect the overall health of our citizens, families, and employees, states Chairman Hughes. The county said that all citizens regularly wash their hands with soap and warm water and practice social distancing. All committee and board meetings have been canceled starting March 16th through April 5th. Muskegon County has activated the emergency operation plan. In addition, Muskegon County has activated their emergency operation plan activation, and the EOP provides joint planning responses and aligns our resources accordingly with a wide range of partners throughout the county. For more information, please contact Rich Warner, our Director of Emergency Services, or Kathy Moore, Public Health Director. For statewide and national information on the virus, you can contact michigan.gov coronavirus. Both of those were presented today. One of them has gone out to the press, one of them has gone out to the employees. I'd like to invite Kathy Moore to come up and give us some more information.
You know, the first thing I want to say, is this is, again, a novel virus, and we've never seen it before. There is no treatment. It's just changing every day, and we're trying to align with CDC and the state. The state holds meetings regularly. We had another 2:00 meeting with the state today. And, you know, yesterday we confirmed that they would notify us of all tests, even if they are negative. Today they said they will not give me a call and notify me if a test is negative, but they will send a fax. So it's just evolving every day. And I think some of the criticism is the constantly changing messages, but that this is the world we're in right now. So I do appreciate activation of the emergency operations plan. I think it gives us the power to contact some of our major stakeholders, invite them to the table, and align our messages and our planning. I also think that the governor's 100-person assembly initially was a recommendation. The 250 is a requirement. And so in the interest of public health, I believe the 100-day, we should still look at any events that are 100 or more, and still, I will still contact them and ask them to at least implement these safeguards or consider canceling that as well. I agree with Superintendent Tony Barnes that they are also public service agencies, and they are also subject to the public coming in. The way public health looks at it, we do contact tracing. And if you're having an event like with your family and you know everybody who is there, and then one of them is found to be a positive, we can contact you and you can give me the contact information for everybody at that event. If this is an event where you are opening it up to the public, even if it's 100, if we can't trace the people, if we cannot contact the people who were there, we are still not really mitigating the exposure. So with the townships and the villages and other public offices, because just the general public can walk in and it could just be a general question and then they walk away, and then if they find that one of their employees has tested positive, it's really hard to go back and say, these people. Some other agencies, like even a doctor's office, they know who their clients are. They know who came in and they know they have the contact information for those individuals. So I agree with Tony Barnes' assessment, and I pulled together a very weak letter. I think this board has probably a more powerful message if that was a resolution that the townships and villages consider following suit with the county. One of the reasons is that the governor is closing schools for 3 weeks to mitigate the spread. If everybody follows suit, so this is just an opportunity. We did not initiate the school closure, but since it is initiated, this is an opportunity for everybody to pause and say, you know what, let's everybody try to limit exposure. And we would have more effectiveness and a better chance of stopping the spread within this time period. I wanted to say that. I also wanted to introduce you to my amazing, well, it's not my staff, it's your amazing public health staff that I'm just the face, but these guys are the real deal, and we are working just diligently behind the scenes. We will still report on Monday. We are the 24/7 number, so we're still in contact with the state. But I wanted to introduce you to some of the leaders behind public health. So if you guys would please, Jane, Dr. Hope, Mike, and Dory, and if you would just introduce yourself and maybe just a brief role of what you're doing with the COVID. Introduce yourself, your title, and a very brief.
My name is Jin Chang. I'm public health epidemiologist. I also supervise the whole nursing program. Under the leadership of Kathy, we work together. Just like her said, she said, we work 24/7, and our phone, is on 24/7. We deal with public health crisis. So I'm here. Okay, thank you.
Thank you.
Hi, I'm Doug Hoke. I'm a physician. I've been in town since '83. I've been the medical director here since '85 or '6, I forget, from the University of Illinois Medical School, but I took my public health training at U of M. And actually, do you have any questions for me?
What is your
Medical
role?
director.
I'm sorry.
Go right ahead.
What is your role in combating the COVID virus?
Well, in the one sense, from the public health department, this is not different than business as usual. We trace contacts. This is a contagious disease, human to human, and we don't have a vaccine or treatment, as everyone knows, but we do have quarantine, but we have to know who. And so when a case is diagnosed, and that's been an issue, as you know, with limited testing capability, which is ramping up. And in fact, we're in the process of making a transition from sort of restricted testing to trying to open it up. I can assure you we're going to get some positive people in town. I'm pretty sure it's circulating right now as we speak. But we need to identify these people, make contact with them, educate them as to how you do this at home, how we can help them make this happen. As you know, we're looking at 14 days. So that and so that's the traditional public health job. It's not necessarily per se treating each individual. It's doing the contact tracing and what we can do. I don't know if that answers your question.
Well, I wondered specifically what your role as on the health department, what your particular role is.
Well, I am a physician, so I have to sign all the protocols, and I mean, all the medicines are under my name. All the protocols are under my name. You know, whether we treat sexually transmitted diseases or TB or all the immunizations. I mean,
Yep, that's what I was looking for.
yeah,
Thank you.
okay, okay.
Hi, I'm Mike Esslick, Operations Manager at the Health Department. Been there around going on 6 years. My role is Incident Commander at the Health Department for this particular situation. And so if you have anything going on in the next couple of weeks, please call me or, of course, Kathy. Thanks.
Thank you, Mike.
My name is Dory Peters. I'm the Public Health Emergency Preparedness Coordinator. This is my second pandemic with the county. Been around a little while. I am liaisoning currently with the healthcare providers, businesses, anybody from the public who's got inquiries and worries. I participate in planning meetings and coordinating meetings with our regional hospital, EMS, law enforcement, fire, all those kinds of partners to try to coordinate our planning efforts.
Thank you. Go ahead, Doug.
Do you have adequate PPE for all of your staff?
The department,
Yes, ma'am.
the health department does not regularly have a stockpile of PPE. They have PPE for their daily program operations, but beyond that, we don't have like a separate cache for this type of a scenario.
So will you or your staff be involved in any testing? Drawing samples?
No, public health is not testing or treating residents. We are behind the scenes investigation, contact tracing.
So that contact will all be electronic, phone, or email then?
Yes,
Okay.
yes,
Thank you very much.
yes.
Are the other health departments doing testing?
No, so there are a few public health departments like Ingham Health Department who is also a healthcare provider. So we are not a healthcare provider. We are not a primary medical home for individuals in Muskegon County. So the process, and that, I think that's what's so confusing. So the process initially was that people go to their healthcare provider. The healthcare provider worked with public health to get the test conducted. Then later, it was said that the physician themselves, the healthcare provider, could order the test and submit it without going through the public health department. But there's just the back and forth. Yes.
Anyone else?
Just a quick question, and that is when a citizen comes to me and says, I think I need to be tested, is there some place I can just say, here's where you go?
Yes, they can. They really need to contact their doctor, just because it could be influenza A and B.
But I've heard stories lately that they say, go to the ER.
The doctor?
Yes.
And we are working. We had a meeting with the emergency manager of the Mercy Health Department this morning. He came in and he said that he was going to go back and talk with senior leadership at the hospital and clarify that process. So they are very aware of the process, but sometimes I just think the confusion in messaging doesn't necessarily come from local. It's some of the media. And as Commissioner Hovey-Wright alluded to, the public health departments and the roles in different jurisdictions are different, and that can be
Still
very
need
confusing.
to know when somebody comes to me, who do I send them to?
They should see their doctor. They should call their doctor.
We
Call
also
ahead.
then to let the doctors know that they are on the hook for it because they're not necessarily doing that process.
Yes.
It's also recommended that if they go to the doctor or the emergency
Let them
room,
know ahead of
That they
time.
call ahead of
they're,
time. Yes.
let them know that you're in the parking lot so that they can take appropriate measures to protect everyone else in the parking lot.
Yes.
Yes, Commissioner, I'll be right.
In partial answer to your question, on the way here, I was listening to NPR, and the president had the presidents of Walgreens, Target, Walmart, all the chain pharmacies, et cetera, and they were going to dedicate a part of their parking lot to a drive-through testing process. Now, when that's going to be available, I don't know, but
You know,
so it doesn't affect other
in
people.
terms of citizens who are sick at this point,
Right. So any citizen that is sick for any reason should contact their doctor.
I hope the physician is able to understand what his process is supposed to be.
And we
because
are
they have-
working.
Several citizens have been passed from doctor to ER back to doctor.
So if they are sick, the doctor's role is to assess and treat if they can, and then order the test if they've eliminated some of the other possibilities. I think the confusion is that they may not be sick. They may feel that they have been exposed and they just want to get tested. And so just like for any other medical condition, a doctor does not order a test if they feel the individual doesn't need it.
And I understand that, but I would like to be able to tell that citizen where he or she needs to go.
And that would be to their doctor, just like if it was any other ailment.
Well, I would hope then the doctor understands what hers or her or his role is, because that's not been typically what's happening.
And I don't disagree. So I do believe that enacting the emergency response plan, it will, and also closing regular day-to-day operations, we can focus these critical resources on aligning the message and the response with our major stakeholders. And the hospitals and physician offices are just one of our primary stakeholders.
Commissioner Nash.
So I guess my question is this the same case that we're going to have with this emergency plan for people that have other health ailments or emergencies that may come up? And I'm worried about how this is going to impact our mental health department, how it's going to impact any other healthcare needs or whatever we have.
Community mental health was at our meeting this morning, and they already have a plan and process and the ways that they're going to handle that. The plan is that here we won't have any employees working except essential. Nobody will be here to do things that they lacked doing before. They won't be doing any regular work. They won't be doing any catch-up work. They will be here to do an essential job, and that's it. Won't be anybody here. Once we do this, we hope that we will automatically qualify for some federal funding. Rich, do you have anything you want to add to that? I don't know what to say. It qualifies us for a lot of different things, and it organizes some of the ways that we react. For example, Rich explained this morning, when people call 911 and want an ambulance to come and get them and take them to be tested, they go through a whole series of questions so that they can rule out whether they actually have a regular medical emergency where they might be having a heart attack, or they actually believe that they've been infected with this virus. If that's the situation, they will respond with an ambulance, but not a fire and medical team that way, so that we don't expose everybody there. So our 911 is on board with that. Our emergency manager's been working with different parts of the community, so I think we're doing the best we can.
To add to that, Health West, talking to Julia Rupp today, she has her list of essential employees as well as a lot of other directors here too and elected officials. They all are working on the list of essentials. So there's still going to be essentials coming in. The doors are going to be locked, the staff aren't coming in, but essential work that needs to be done is being lined up as of today for people to work on next week.
And Health West is establishing a list of questions that they'll be asking people who call in emergency situations so that they'll be prepared to decide whether they need to be prepared when they go for coronavirus.
Well, and I'm not just speaking of corona. I'm saying if someone has a mental health, a severe episode of some type, and they need care,
They will have people there to answer the phone and go to those calls, and they will at their
call Health West first.
Yep.
Okay, that's what I'm trying
Unless
to say.
it's an emergency, then they should call 911.
Okay,
Madam Chair.
but no services is going to be provided there. That's what I'm.
Well, I think the emergency services they provide right off front when someone does want to come in and visit, they handle that. I mean, obviously, if there's a drug overdose or
crisis.
something else, they send them to the hospital. But Health West is having essential staff report to work on Monday to deal with those.
Yes,
Commissioner
Madam
Wilkins.
Chair, I'm thinking of the people who have no physicians of their own, and I think we're going to have an increase at the hospital at the emergency because they're going to go there and then they may be diagnosed or whatever. But that's, I think, where the increase is going to come from because a lot of them don't have their own physician.
Right. And so we are asking them, of course, not to just report to the emergency room, but we do have on our website, and we do have a flyer that says if you do not have a healthcare provider, we have a virtual assessment through Spectrum. They've given us a link for that we are referring. Our Muskegon Community Health Project, they actually help individuals in Muskegon County find providers. And then there is a physician referral line that also helps find providers. So again, the COVID-19 is it's an actual medical test. So the test goes to a lab. The lab does not report back to the individual. The lab reports the test results to a doctor. So what the state has explained is that, you have to have a physician, just like if you had a test for high blood pressure. They don't just take the test, send it there, and then the lab, it has to be in consultation with a physician who knows how to treat and or at least supportive treatment for any ailment.
Yes, Commissioner Nash.
Well, the other question I had is what information are we getting out to the community? Because like Commissioner Mahoney asked a question and Commissioner Wilson's asked a very good question because us informed individuals here can hear and know what's going on. There's a lot of people that are not as informed and not as connected with the government and things of that sort. So how are we getting this out to the general public, and especially those that are hard to reach?
I think it's really hard to counter social media and all the news. The issue is that it is changing on a regular basis. Like I said, initially, a physician would have to come to public health. Now they can do the swab and send the test themselves. We had submitted a couple of days ago that Muskegon County had no positives, and we recommended business as usual. Later that day at 5 o'clock, the governor had an announcement and recommended that we limit social gatherings. Then and that was just a recommendation, it wasn't a requirement. Then we had 2 positives, then 3, and then 12. And the recommendation turned into an executive order. So the news is constantly changing. It's not stagnant. So we can try to print a flyer.
I'm not speaking of news. I'm speaking of steps that people need to take. Like we just talked about, the healthcare industry is going to get bombarded.
Yes.
So people need to know when they should call and where they should call and steps that they need to go through, even with mental health, who they should contact, when and how. You understand what I'm saying?
Somebody will
There's
be on the
different
phone.
things that people are going to have, and we need to get some information out there to say, take these steps or do this.
And I feel
all
like
we're saying is wash your hands,
right.
and that's not working.
Well, that's the best way to prevent it.
No, I mean, I get that, but I mean, how do I follow these steps if I have an emergency? That's what I mean. Is how does an individual follow those
I think
steps?
the message has been very consistent that you contact your doctor. It's the same as if you had an emergency for any other ailment. It just because of the scare. I think people want a quicker answer. There's no quicker solution.
I like your answer, but how many people in the public know that right now?
I'm
That's
not
what I'm
sure,
saying.
but because every time I see CDC, that message is consistent. The governor's message is consistent. Everywhere it's very consistent. So I don't know if it's not sinking in. I'm not sure what we can do to make it sink in, except to say it over and over and over again.
Just as come back to Commissioner Realstein Wilkins' point, a lot of those folks don't have a physician.
I'm trying to get at.
So they are used to doing emergency care, which
Yes.
is not where we want them to go. So to tell them to go to their doctor, they don't have one.
And so we do have the page of the referrals, which is
I understand
yes.
that, but that's a process.
Yes.
You know, you may get into this a physician, you
Absolutely.
may not. Is he taking or is she taking new patients?
Yes.
They're looking for a little bit quicker response.
I understand that. The problem is that there is no quicker response.
Commissioner Skolnick.
You know, I just wanted to say I happened to walk through the emergency room 3 or 4 days ago, and it was pretty packed. One of the things I'm concerned about is if people just are automatically going to the ER and say somebody does have the virus and they're coughing in the ER, they're contaminating the ER, everybody that's in the place,
Got
and
it.
it's
Right.
dangerous. I mean, there needs to be something. I don't know what the answer to this is, but maybe you think you have the coronavirus, go over to this trailer over here, or go and take a number,
I
go
will
in your
haul you
car
away.
and come out and test you, just to keep it from everybody else getting it. That's number one. Number two, I got a message this morning from an employee, and I think we need to think about, I don't know what this is going to cost, but to disinfect all the county facilities, this building, and while everybody's out of them, go through them and do the best we can. I mean, it's not a perfect process. I
Right.
understand.
Matt Fair is working on that very thing, working with our janitorial services and make sure that thorough cleaning has gone through the process, which makes it easier when staff aren't here
And-
or the general public.
And one thing we forget about that's very important is your telephone. You know, you lay it on the counter, it picks up everything there. So make sure that you're careful and using caution when you use your telephone. Wipe it down.
I don't know where that phone been at.
One question.
Yes, Zach.
So I actually have a couple questions too. If I understand this correctly, the emergency management system is going to be disseminating information to all of the community partners. And to answer Tony Barnes, is that going to our townships? Is that going to be addressing the communication link, or and even Commissioner Nash? So that information, is that coming out of the emergency response team? I mean, well, they're the point person for media and information. That's the way I understand it.
Yeah, so the emergency response team is an aggregate of community stakeholders. And the idea is to come together and align the response. And so I think this is the best opportunity when you're talking about the emergency room and that message. We don't dictate the emergency room or the operation. So this is the best opportunity to come together with Mercy Health and have a joint press release, a joint statement. And then when things change, which they could change before we leave this room, to reiterate, the new statement. So that's more of an alignment of critical resources among all local stakeholders so that we have a consistent message. The request to limit and or restrict public access, it's probably a little more immediate because we're asking that this happen during the same time frame as the school system. If it happens after, then it doesn't necessarily have the same effect.
Kathy, I see hiding. Oh, just saying, I see hiding over here in the corner, Laura Fitzpatrick.
Hi. Yes.
Laura, do you have anything you'd like to add to that? Where people could go or something? I thought you might be, with Mercy. I know you're with Mercy and the Health Project and stuff. I thought you might have some additional information that we don't have. So I'm calling you on the spot, unannounced.
I just want to, well, thank you, Commissioner Hughes. I appreciate this. And thank you, Kathy, for all the information you're disseminating out to our community and our leadership. I appreciate that. One of the things that Mercy Health has restricted visitors. We are down to one visitor per, we're trying to encourage people to have one visitor per patient. We're constantly monitoring this. Our incident command has been open for a week now, so we are monitoring that. Meeting with the health department, again, joint press releases, those kind of things are important in the communication going forward. I know Kathy's been very diligently working with our leadership, constantly communicating with them, and now it's just we should probably we're just working forward. Working on a public and joint communications going forward. So we align. So anything we can do. Kathy and Dr. Chang reached out to me this morning, and the Health Project staff leadership earlier this week. So I just want to reassure you that it has been a collective effort, but just anything we can do to help get more information out. We do have a website that's open right now on Mercy Health, and you can click on our website. I was looking that up. But it does have information on coronavirus, and we did share that with public health today too, so they can link with our stuff. So,
Laura, what about the Medi centers? I know Mercy runs some Medi centers. Would they be an option for people to go to for testing?
For testing, yeah. Now, I don't feel comfortable speaking on behalf of Mercy.
Okay.
I just want to let you know that we are planning testing centers.
Okay.
I believe one opened in Grand Rapids yesterday, and so, but I just want to be to be aware. Chair Pullen, maybe you know more about this. I know you're with Incident Command, but Mercy Health is looking to make sure we ensure testing for those people at risk.
Perfect. And you will let Kathy know that will, so we can put that on our website as soon as possible.
Yes, you know, I'm very
you're
confident.
working
Well, no, I'm very confident that public health and our Incident Command, or what do we call it here? Government Response Team. What is it? Emergency Management Team. Dr. Evans also sits on that team and has been in communication with Kathy as well.
Thank you.
Anyway, I'm sorry I can't answer more questions. I wish I could.
If I had asked you to be prepared, you would have been able to. I called you on the blue, so I appreciate it. I just saw you sitting over there.
Yes. Thank you for putting me on the spot, as always. I appreciate that. I also want to praise and thank all the leadership here at the county for your work. And, you know, we just have to, I'm on the Public Health Advisory Committee, and the goal for that has been to remain calm and collected and to reassure people. But now we've elevated this week. So it's a different world than it was just 1 week ago. And as we see this virus coming forward, it's going to be a different week every week. So just as leaders, we need to stay calm, constantly align our communication, and just make sure we're providing the most information, the best information to our constituents and patients, the best that we can. So there, thanks. Thank you so much.
Thank you very much. Does anybody Zach, you have another question for
Yeah,
Kathy?
I actually had three, so I get down the other two. First responders, have they been ambulances? Have initially there was some conversation about the ambulances would need some special equipment for first responding to potential coronavirus patients. PPE for first responders, are we moving? Is there adequate PPE for these individuals, or do we need to do some work on that?
I don't know, Rich. Are you able to answer that? The EMS first responders are actually under the governance of Mercy Health, and that would be their emergency response plan to assure that they protect their employees. It's my understanding that they do, because at any time they could be exposed to a plethora of viruses and diseases.
Okay. And the one last question I had, so I just want to make sure I understand, your recommendation is still that social gatherings would be at 100 or less.
So the public health response is to contact trace for any incident. So for any individual that is positive. So part of the initial intent behind the 100 or less was that so that we wouldn't inundate our critical resources. If you had an event of even 250 and you had a positive person, now you have potentially 250 people who may get sick, and we may not have the resources to handle that all at once, because this is a novel virus. To limit the social gatherings and limit the public exposure means that we are at least limiting the number of incidents that may happen at once. It's going to come here. It may already be here, but we're trying not to get a whole bunch of people sick at one time.
Thank you. Commissioner Foster?
Kathy, real quick, your first thing when you came up was to support our townships. Am I correct? Going way back.
Yes.
So you would like to see a motion from this board recommending to the townships that they follow our procedure for the next 3 weeks.
Yes.
So I would like to make that motion that we follow the health director's advice and recommend to our townships they do the same as we are doing.
Second.
We have a motion and a second. Is there any
Discussion.
questions?
Just townships,
Townships and villages follow our
Townships,
leadership.
villages, and cities. I'm assuming this is
Yes.
correct.
The cities are
The,
doing
the
pretty much,
municipalities.
the cities are doing their own thing as far as their closing.
Okay.
I've been reading throughout the day different ones doing different things, but they are closing their to the public coming in. Some are still requiring work. Some are still having board meetings. So some of the cities have already sent out some stuff. I think the city of Muskegon had a press release they already sent out.
But we will make that township and villages.
Yeah, just make them aware.
Correct. It's
We're
just
not
a
going to force them to
recommendation.
do that.
This is a
but
recommendation from the
Okay.
county board and the health director.
Okay. Commissioner Nash?
Well, I just wanted to say I'm understanding what we're trying to do, but I'm concerned about whether this is really going to be effective. And the only reason I'm saying that is because we have no jurisdiction over these private organizations in this community whatsoever. And all of them are not closing. And so people are still going to be moving around and they're still going to be coming in contact with each other on a regular basis. So we may be shutting down, but we may be shutting down and it not really having a major effect, because I know right now, my employer's not closing. We are taking precautions,
right,
and there are things that we're changing, but we're not closing. And so I guess that's my concern, is have we really looked at everything that we're doing? Because we can close everything. That's easy to do. But have we looked at it to see how effective it's going to be? Because it's going to have a major impact on this community, and especially an economic one, which lives are more important. I get that. But it's going to have a major impact on us. And so how is this really going to work for this community? Because if we shut down for 3 weeks and people are still moving all over, we may come back in 3 or 4 weeks and we still got a big problem. It's getting worse.
Oh, go ahead, Kathy.
I agree. Again, though, we did not initiate this. This is the governor's executive order. The recommendation is that we align our limitation with the governor so it has a greater impact. So it is true that it's still going to spread. It is. It may already be out there. What we're trying to do is mitigate and minimize the episodes, the number of episodes that happen at one time.
And by closing these just this building itself, we can eliminate up to 2,000 people a day being in and out. I mean, we very seldom do you get on the elevator by yourself. And right now they're recommending 6 foot in between. That means Mark and I are way too close. So I'm just saying,
Madam Chair.
So, and I'm too close to you too, by the way.
Heard it summarized best on the way home today after this morning's meeting. It's best to say in 6 weeks from now we overreacted, because then we corrected it. It didn't happen.
Yeah.
Instead of saying we should have. We have to react to this.
Madam Chair.
Yes.
I think most of you know that my wife is in a skilled nursing facility, and I went to visit her this morning, and they wouldn't let me in. So I don't know what that means exactly, other than if they won't let a spouse in.
It's a very vulnerable population, and they may be just trying to restrict. We can hope that they're just trying to restrict. Is there any other questions for Kathy?
I
Commissioner
just want to make
Snyder.
a comment. As one who grew up with the polio epidemic as a youngster, this is reminiscent of that same type of occurrence that took place back in the 30s and early 40s. And I come from a family that lost a number of people, siblings not of mine, but cousins. And I was in contact with them. I, for some reason, survived. They did not. I think what we've got to do is remain calm, which is what we did when polio struck. And I think so many people are throwing so many things at the wall that we're not really accomplishing what we need to do. And that is to focus on what is right, stay private, try to stay out of a social context in which you will be or could be infected, and above all, follow the recommendations that are being made by the medical community and by the community in control.
Kathy, I'd like you to stay for just a minute as we move on to something else.
Madam Chair,
Oh,
can
yes.
we didn't get a vote on the recommendation on the townships.
Oh, okay. Right.
So
Could you
we just-
restate?
We had a second, but we didn't go any.
And that's a motion to recommend to the townships or offer the same plan that we have to the townships, cities and villages. And whether the cities or villages take it there, or the
It's a
townships, it's
recommendation.
still a recommendation. Are there any other questions on that recommendation? Seeing none, all those in favor, aye.
Aye.
Oppose the same. That motion is carried.
Ma'am?
Yes.
May I have another one now? Since you're still standing there, Kathy, could I make a motion that we take the public health director's advice and recommend no gatherings over 100 people?
Second.
While this epidemic or whatever we want to call it, her wording. I'm not sure how you want to word that, Kathy.
I think recommend is fine because
Recommend, okay.
that what I would do is just contact the organizers of the event and just say from a public health perspective, if you're going to move forward with that, we'd like you to try to, collect the names of all the people who are going to be there. We'd like you to have stanchions and.
Would you like us to have them contact
Do
you?
you want to make the motion and I'll just make it?
I think just that if we would recommend with the activation of our emergency
response plan,
that social gatherings of 100 or more be canceled as well.
Okay.
So those words, I'll make that motion.
All right. And
Second.
I have a second. Who seconded that? Commissioner Leering. Is there any other comment?
Just a quick question on that. Isn't that the governor's recommendation already?
It truly is. And so what I think what's confusing is that then today she came back with an order. So her recommendation is not to do it for 100 or less. Her order, I mean, they are breaking the law if they do it for 250 or more. But again, with public messaging, people get confused. It's like, oh, now it's 250. But there's a difference. The 100 is a recommendation. The 250 is the requirement. And basically, this board would just be reiterating
what the governor.
Yes.
What the governor has said.
For clarification, shouldn't that be put into that too also, though? That 250 would be a violation and 100 is the recommendation?
So that is already an executive order by the governor, so we don't have to reiterate law.
Correct.
Okay.
Madam Chair.
Yes.
Yes, Kathy, they are, you're asking for the 100 names, but actually this is going to be used for tracking in case.
Yes.
So how are we going to get the telephone number from the names that you have? Because they're going to jump.
And that's really just a strategy to discourage people from having an event of 100 or more. And so far, 100% of the people I talked to, and I told them what my recommendation is, they just said, I'd rather just cancel it than do that.
Okay. Any other questions? Seeing none, all those in favor, aye.
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 That motion is carried. I'd like to move on a couple other things. Okay, next we have Kathy. I'm probably going to want you for this. This morning at our meeting, there was a recommendation to cancel the MATS service. That was a situation for the 3 weeks. I did not follow through with that on this recommendation today. I wanted to bring that to the board. I think that's something that should have a little bit more discussion, and I think that's something that requires a board decision. Kathy, I understand Kathy's position that, we're going to have a bunch of kids out and possibly, on the buses, and we also have elderly people that, are on the buses in direct contact with each other, and that could potentially cause a problem. But it also limits people being able to get where they need to go. I do understand that in this time with a medical crisis, we would prefer that they contact a family member or friend and have them either do the grocery shopping for them or take them to the doctor or things like that, rather than expose them to everybody on a MATS bus. But for those that are unable to do that, I think this board needs to discuss that. And Kathy, if you'd like to give us your opinion on that, I would appreciate that.
So again, I come before you as the public health director, and the public health advice is that we do not perpetuate situations that would cause individuals who may be carrying the COVID-19 to spread it to other individuals that they don't know or we don't know how to trace. I think you guys do have quite a dilemma before you, because you are talking about a vulnerable population that may have no other way to get around. We are not following New York, who canceled their mass transportation, because we are not New York. But if you use that as an example, they canceled, and their ridership, of course, is majorly more. So the advice I give to you as the public health director is that we don't contribute to helping the spread, at least for this 3-week time period. But again, I respect the decision of this worthy board.
Thank you.
Madam Chair.
Commissioners, pardon me? Let's see what kind of questions we have. Commissioner?
I didn't really have a question. I kind of wanted to do the motion so that we could have a good discussion on it. Would you prefer we go that way?
No, I guess if we have a motion, we can, that
I would make the motion that we follow the public health director's advice and close down the match for the 3-week period.
Second.
We have a motion and a second. Now I will open this for discussion.
I have a question on, would that include the Go Bus and the...
That would be up to this board, ma'am, or the chairman.
So you're just talking about like the
Actual
fixed
buses.
The fixed.
The
I think
fixed routes.
let's take the fixed routes right now, because
yes,
because this is a major decision. Any
I think,
any
one
comments? Go ahead, Marcia.
one consideration, and I'm not saying it should rule, but I mean, for many people, like our commissioner here, their work is still going on, and they still have to report for work, and so we're making it impossible for them to go to work, or very difficult. Now, certainly people can get help from other workers or whatever, but that needs to be considered in the whole thing.
That's exactly why I brought it back here.
Yeah.
My concern with it is hers as well, and I give the general public some credit to know when and how to conduct themselves. They're avoiding big crowds, all of that. And we're doing the education part of it to tell those folks not to do that. I doubt very much that they want to climb on a very crowded bus at this point, if they're aware of what's going on at all. But it's absolutely essential for some of those folks, unless we want to take on the liability of paying them when off work.
which we do not want to do.
Yeah.
Are there
Madam
any other
Chair.
comments, Commissioner Waring?
It was mentioned today that we would be best to err on the side of caution. It is not our responsibility to provide transportation for the people in the community. They may have grown to depend on it, but it is not our responsibility. There are always emergency services available if that they need to get to the hospital or not. If they need to get to the hospital, they're not supposed to be getting on the MAT service anyways. And New York's, this had a bigger impact on larger municipalities. Unfortunately, they caught the situation too late. It's loose and rampant in New York City. In some of the suburbs, they've already called out the National Guard in New York City. We do not want that to happen in Muskegon County. I believe this is a 3-week period that we can take a break. We're going to reevaluate by April the 6th what we're going to do. Maybe we curtail it here, but if we don't catch this early in this county, it will be too late. And if this virus gets loose in this population that utilizes the mats, it's game over for Muskegon County. And we're here with doing extraordinary measures. We talked this morning that half-hearted measures are going to send mixed messages and be ineffective. I think the governor took a bold step yesterday in canceling schools. It's causing hardship across the entire state. This will cause hardships. We have to make tough decisions here and acknowledge that there's hardships going to be caused because of this. But if we don't stop this before it gets into our county on a widespread manner, we could potentially have I don't even want to throw the word pandemic in our own county in its best. We will be thanked if in 3 weeks from now we have no more cases. Praise the Lord, we just move on. But if we have a couple of cases on that mats, it's going to spread throughout this what we call the vulnerable population, and we're in trouble.
Commissioner Harvey Wright?
Yeah, I would like to ask Mr. Coons to come up to see if he has any thoughts on this. I do feel that we have an obligation to transport.
Jim Coons, Muskegon Area Transit System, 2624 6th Street. Well, commissioners, this is your decision to make on how you want to move forward on this. It's my understanding that New York had talked about closing, that may not have actually occurred, that they're looking at that still. I do know employees are concerned about exposures. People rely on the public transit system, but it is also, exactly as Public Health Director said, it is bringing people around the community, and what you're looking to do here is try to reduce the amount of movement. So I'll say it's your decision on how you'd like to go forward.
Jim, can you tell me how many drivers you have that we could potentially expose if something like this were to happen?
Our driving staff is just under 50 employees.
Okay. All right.
I got a question for Jim. When the school's out during spring break or in the summer, do you see a lot more kids riding the bus system? I mean, the whole thing is the governor's trying to keep the schools closed so that the kids aren't spreading it. Are we encouraging kids to ride the bus system?
Typically, with schools out, K through 12 schools out, our ridership is not up because of that. It's typically actually down, probably because those few that do take the public bus system to school aren't taking it. Yesterday, I was asked by the board if we're seeing a drop in ridership so far this month. I did look at that, and through the first 11 days of the month, we had really not seen an impact of people on their own reducing travel. With the colleges now, with the college closed, et cetera, I do expect that will impact ridership. Those riders tend to use the bus more than the K through 12 students.
Okay. Commissioner Snyder?
I agree with Mr. Luring. I agree with Commissioner Luring. I think we ought to close it down.
Commissioner Nash is next.
Well, I just wanted to say that my concern is that with the bus system, probably 80 or 90% of those people that ride that bus because that's the only way they can get around. And if we shut it down, they don't have any way to get around. So that's something that we have to think at. I think it would be wise to reduce it. But I think also we got to let people know, because just abruptly just cut it off, you know.
That's why.
See,
That's why I said we need to discuss this today, because if we do something like this, we would probably start it on
Right.
Monday, just like we did the closures of the county.
Because some of us didn't grow up poor, and some of us didn't grow up disabled and other things. So you have to understand it from other people's shoes. Sometimes we're ripping their lives out from under them when we do stuff like this. I do want people safe. I do not want this virus to spread. I want to make sure people understand that. All right, but I don't want to be so insensitive and so knee jerk that I'm not really thinking about everything. And I think I just want to make sure we're looking at the big picture. Right, we could err on a caution and nothing could happen, but we could also reduce things and maybe nothing could happen, or we could see if it became a problem, we could reduce it even more or just eliminate it. But I'm just concerned about just moving so fast.
And you said 50 drivers is what we would have, or 50 employees that
Up
would
to
have
50
public.
that are on the road.
All right.
at that very
Commissioner Skolnick.
Well, you know, as we've been listening to comments from the audience on potential changes to the MATS routes, I become pretty sensitized to people with disabilities, maybe more than I was before. And, you know, many of these people without MATS, they have no way to get anywhere. They might not have, might not be able to go to the grocery store and buy $100 worth of groceries and stock up for a week or two or whatever it amounts to. I have a hard time closing that down. The buses, the Go bus would operate anyway. I believe that's what we're saying, because there's only one rider.
That's
on that.
one.
There's one person on that.
And so then you got the fixed routes, and the buses are never crowded.
Right. There's not a lot of people on the buses.
I understand what we're trying to do.
I think this morning our concern was not only the people that were riding it, but we're limiting, we're protecting, doing our best to protect the rest of the employees of the county. We're kind of leaving the MATS people hanging out there too. And I think we need to think about that too. There's a lot to think about on this. There's a lot. Commissioner Foster.
Ms. Moore is our Director of Public Health, and for her to stand in front of us as the Director of Public Health and make that statement about the MATS buses, we need to take that serious, very serious. That was something we never thought in our lifetimes we'd probably ever hear from her.
That's exactly
and we
right.
heard it. So we need to act on it.
Commissioner Laring.
So my OSHA has a requirement: if an employer exposes an employee to a known hazard, the employer is responsible, and that would be us. So those are 50 employees that we're going to expose to a known hazard. That leaves this board liable for their health. You're not, anyways, that's enough said with that.
Marcia, did you have another question?
So what I was going to say, I'm sort of catching the concern here, but is there a way to encourage the riders to only board the bus if it's essential, if it's critical to their work, or they have
I'm thinking
to get?
that's the only reason they ride it anyway. I mean, it's not like it's a quick trip to the grocery store. It takes you 2 hours to get there.
Well,
So I'm thinking they're not riding it for fun.
no, I know that. I don't know. I mean, are we also liable if we take away the bus, their only way to get to work, then they might lose their job? I mean, there's.
I would hope, I guess, I've thought about this a million ways.
Yeah.
I would hope maybe in this situation that the employers would pick up some responsibility and say, hey, so-and-so lives out by you. Can we carpool a little
Yeah.
bit for 3 weeks, and see how this goes? And hopefully in 3 weeks we'll have a little better handle on what's happening. I don't know what to say. That's why I brought it back here rather than
I
move
would
forward
think
with
they
it.
would need some time to make other arrangements.
That's why we have to make a decision today and not Monday.
Well, true. But is that enough
That
time?
way you got a weekend to, get hold of your people and your family and Commissioner
I
Nash.
just wanted to ask Mr. Coons about the employees. Are the employees all hourly?
No, we have a mixture of full-time employees and hourly employees.
Okay, so some would be like salary. If we close down, they would still be
Full-timers,
compensated.
according to the
Yes.
earlier communication today, full-time employees.
Does
would
some of the
continue to be
hourly have vacation time built up, or
hourly employees? I'm
Yeah.
sorry. No, they would have. If there's no work, they would presumably have no hours to pay.
All right. Madam Clerk, could I have a roll call on this, please?
what's the motion?
What's the motion? The motion was to have the match shut down for the 3-week period that the county is shut down.
May I ask a clarification? So we separated out fixed routes versus
Fixed routes. I'm sorry, just fixed routes. I
Fixed
should have
routes.
added that in
Commissioner Nash,
No.
Commissioner Skolnick,
No.
Commissioner Snyder,
Yes.
Commissioner Wilkins,
I'll pass.
Vice Chair Foster,
there. Yes.
Commissioner Hovey Wright,
No.
Commissioner Laring,
Yes.
Mahoney,
No.
Commissioner Wilkins,
No.
Chairman Hughes,
No. That motion fails. All right, let me see here. Look at my list and see where we are here. I'd just like to remind everybody that there are some orders out there for people that have RI-60s that need to be dropped off within the next 3 weeks. They can drop those off at the front door. There will be somebody manning the front door. Everybody, essential employees only. There will be no regular employees here. Nobody doing regular work. Nobody doing catch-up work. The employees are shut down. They are to go home. We're trying to get them out of here. Let's see. Is there anything anyone else has? Administrators report. Yes.
Well, I wanted to bring up a point regarding this bus situation. If we get to the point where we find that our ridership has dropped significantly,
Mhm.
or that this situation with the virus has changed and maybe even gotten worse,
Mhm.
what steps would we be able to take to make sure that we could have a
We're off for
reduction
3
or a
weeks now.
shutdown? Pardon me?
We're closed for 3 weeks.
Well, that's a good point.
I get that, but
the
we
governor
still
could
need to
come out
run
and
this
pick it up.
county.
Right.
If an emergency arose, we could call an emergency board meeting, I suppose.
Okay, so how's
Like
how's that process work?
18 hours. We have to post it 18 hours ahead of time.
All right.
Commissioner Hovey Wright.
I'd like to throw out there an idea, and that is to find a way, and I'm sure you could do that, to warn the riders of the risk and to only use the bus service when absolutely necessary. Does that make sense?
Yeah, Commissioner, we've shared some of the information that came out yesterday from, or this morning even from the no reply email. It was basically information about the virus. I'd be happy to talk with Public Health about providing us additional messaging for that. And then beyond that, we'll do the best we can with the staffing that comes into work. And if we end up with a shortage of staffing, we'll take our own administrative steps to put out what we can on the road, and then keep administration informed if we're having difficulty.
And would you let us know if it drastically reduces, or if you have some pushback from those employees who really don't want to be put in the line of fire?
Right.
Certainly.
I'd appreciate that. Thank
So,
you. Commissioner Nash?
I wanted to ask too, had you taken any steps to require the bus drivers to do anything different as far as wearing gloves or masks or cleaning, sanitizing the buses?
Not since we talked yesterday. So yes, we'll have to address that. Now that I know what direction you'd like to go with this, we will make those additional steps.
Thank you.
Thank you.
Good luck trying to find sanitizer.
Well, bleach and water works really good.
We have stock.
The emergency manager says bleach and water.
Madam Chair,
Yes,
I
ma'am.
wanted to ask Mr. Coons one question. On The buses, when they're cleaning them, do they sanitize them with any kind of solution or something? Because they should be wiped down every time they come in.
We're using germicidal cleaners, etc. We're very limited on the amount of staff we have to do that. And so we're going to try to redouble what we can do in that area. But yes, we will continue to do that.
One more question.
Yes.
I would like to ask our health director, has there been any information that comes out to say exactly what is the best cleaner for this virus?
The CDC did publish a list of cleaning products, and as soon as they published it, everybody went out and bought them all. So there is a list. There is a list, but there's just not an abundant supply.
Do you know what's on that list?
I do, and I'll have to find it and send it. It's quite a large list, though.
I heard on the radio the other day, they've been running out of sanitizers in various cities. They said you can use vodka and water.
Or you can just drink the vodka and not care.
Well, that's the reason I want the list.
Sanitize your insides.
That's why I want the list. Maybe some stuff that's not bought yet.
Kathy, is there any recommended PPE for employees that OSHA has for known hazards, recommended PPE for every environment? We're exposing employees to a known hazard. Is there a recommended PPE for these employees that we're putting at risk?
Personal protection equipment. That the CDC guideline for COVID-19 is that the sick individual wear the mask.
Okay.
The mask doesn't necessarily prevent the healthy person from being exposed. Immediately, I thought about, well, what if we had an employee that just kind of rode the bus and cleaned the bus as you went? I just don't know the best way to do that. But there's not, Gina, unless you guys know a way to protect.
PPE, okay, sanitizer, have to be, alcohol based, 65 to 85,
But we're talking about a bus
100%.
driver who's gonna say hi to everybody that comes in on the bus.
Sanitizing, so okay, sanitizer, and also as far as work on outbreak, CDC recommend do the bleach based solution. So so they have solution what percentage. So that part, is a recommendation. But as far as the bus, I'm not quite sure. But okay, that kind of thing we use for our staff.
So that's there's not really right now
Guidelines at this point.
Right.
All right. Thank you, Kathy. I'd like to move on to the administrator's report.
Thank you. I think we covered pretty much the governor's recommendations for the state. I did have a couple questions on that came to me. It was the airport. Airport is essential services, so that's continued operation.
Good.
The landfills, obviously, essential wastewater, essential water. Public prosecutor, I mean, I know they're still fight crime. The sheriff is still going to bring him in. So a lot of things are still continuing is my message. And I appreciate all the directors who were there this morning early at 7:30. We had a full house and we had a lot of good discussion. I think it came out with some good answers. So appreciate those because I know they're all going to be very busy next week as well. So thank you.
And I'd like to thank our IT department for stepping up and helping those that really wanted to be able to work remotely from home, and our prosecutors and our lawyers and public defenders and things. Thank you. Yes.
What about like trials and things like they're all going to just be postponed?
They're going to be postponed until then. That was that we had the chief judge, both chief judges with us today, and this was actually their recommendation to go for the 3 weeks and be done. Yes.
That was another question I was going to ask, and I forgot about it. Was when it comes to the courts or the all of the courts, all of the tickets. Some of these have deadlines. Some of these have dates. Some things, certain times and dates kick in warrants and things of that sort. So are we going to be adjusting those to those?
Prosecutor
Do
will
anybody
answer
know that?
Right now, and he was on his lapped out this morning just to checking things out
Yeah,
for us.
DJ Hilson, Muskegon County Prosecutor. Yeah, to answer that question, yes. So as part of that discussion, we talked about civil infractions, for example, you have to essentially get yourself turned in within 10 days. We're pushing all that back. So everything really is going to start April 6th moving forward. So during this 3-week time period, I mean, civil officers are still going to be writing tickets.
Right.
But any appearance date, and this is also in conjunction with the Sheriff's Department, any appearance date will be April 6th moving forward.
Right.
So, yeah, I mean, it worked out pretty well.
Good. It's a big question, and because I deal with that community a lot, and a lot of those guys don't know, and they just want to know. And that's what I was talking about when I say information, because there's certain groups that are not regularly involved with, regular news and regular media, and they be getting it certain ways, and we want to make sure the right information is getting out there. And that's why I was even talking about with the health stuff. But even these things are important for people to know, because all I kept thinking about was, what about all the civil people that's got to pay these bills and they can't get them done?
Yeah, well, I took a phone call from MLive as you guys were meeting, and we were having that discussion. So the media is picking up on the fact that things are going to get delayed.
Good.
And that there are certain operations that are continuing. They're going to continue during this 3-week period, but court dates and whatnot are going to get delayed.
Good.
Commissioner Harvey, right?
If the virus continues to explode at the end of the 3 weeks, are we going to meet again to figure out where to go from there?
Yes.
Okay.
We'll meet with the emergency manager and the health department again, and the directors and the judges and the prosecutor and public defender. All right. Anything else?
No,
Mr.
I mean, just the IT department for staff who needs that 2-point verification. They'll be working on those next week to get those completed as well. So if you have more people needing to work away from the office, that's going to time to do that, to get through that process.
All right. Next, any old business to come before this committee? Rich?
Come on up.
Would you introduce yourself, please?
Rich Warner, Muskegon County Emergency Management Director. I just want to let you guys know that the EOC was activated today, but it's virtually activated. I don't want everybody coming there. 'Cause that's the point we're trying to get away from, right? So we'll be, with IT's help, we'll have conference calls. We'll keep everybody in the loop. I did, just before I got here, requested with the state 4 PPEs for the EMS and fire. It's just a request. There's no guarantees we'll get anything, but it's in there.
Okay.
So if we're able to get it, we will.
Thank you very much. Appreciate that. Any old business to come before
And
this
just
committee?
one more question.
Rich,
Our 911 and 211 is in line with all this messaging, correct?
Correct. Actually, the 911 is that's where it all starts. And they are doing the screening to another level. Not the basic level, but they're asking more questions, more pertinent questions, to try to find out if it's a potential patient or not. So if it meets the criteria, when they dispatch the units there, they will give them, there's another phrase they're saying, and that'll give them the clue that, hey, put your PPEs on.
So what about 211? Are we doing any messaging there?
We're probably the message of to go to your doctor instead of not.
Right, that's what I
go to the
mean.
ER.
Yeah.
But again, people that don't have a primary care physician, they go to the Ready Cares, they go to the ER. That is their primary care physician.
Right.
And I don't know that there's any way we're going to stop that. That's just what they do.
Any other questions for the emergency manager? Seeing none, any other old business to come before this committee today? Yes.
Madam Chair, I just a point of clarification. Did we make a motion and vote that we were going to suggest social functions to 100 or less? Was that actually?
Yes, we did.
Okay, thank you.
The recommendation.
Yep. Any new business? Any public comment?
Sorry, just real quick, DJ Hilson again. I just want to, first and foremost, I kind of bounce off what Mark had said. I just really appreciate what happened this morning. I thought it showed true leadership on all levels. in the discussion. It was really good, robust discussion. I mean, we spent 2 hours really talking about this issue. And so as an elected official, I really appreciate that leadership. But I also want to give a special shout out to my counterparts, the sheriff, Fred Johnson, the chief justices, the circuit court and district court administrator, members of my staff who spent about 45 minutes this afternoon really hashing out what it looks like, because there are court functions that have to continue, i.e., people get arrested, warrants have to be issued. And so based on the conversations I had with my staff and working with these fine individuals, we were able to hash all that out in about 45 minutes. And I really believe that during this 3-week time period, if there are any hiccups, it'll be minor ones, and we'll be able to kind of process this stuff through. So understand that there are some really great things happening today in the short period of time, given this kind of how we had to process this really quickly. So my hat's off to my counterparts, because I've had conversations with my colleagues across the state, and it's not going as smoothly as it has here in Muskegon County. Yet again, showing why we are leaders of the state. So thank you for all that leadership. I appreciate that.
Thank you, DJ.
Thank you.
Good work.
Hit that in the press.
Got one more, at least.
Melinda Pego, Muskegon County resident. Thank you, Gary, Mr. Foster, Commissioner Snyder, and Laring for heeding the warning of our public health director. You guys brought all of these people together earlier today for the best recommendations. She gave that recommendation. You're stopping the county. You're recommending townships and municipalities to stop their services, but you're going to let the county public transportation system go on. It's a novel virus. What that means is it is new. They do not know much about it. There is no treatment. That's been said over and over again. You're not mitigating, as you're trying to say that you're going to do, by leaving the public transit system open. Maybe you should find another, I don't know what this GO bus is because I don't use the public transportation, but you have 50 employees that you're going to be responsible for that have these MIOSHA standards that you're going to be liable for. You already have a county lawsuit against you. So you're leaving the 2,000 most important employees that you're saying are most important by shutting down that, and you're not going to shut down the MAT system with 50 more employees. That's irresponsible. You're not heeding her warning, or the public warning, not hers individually, but the public health department. I don't use the public transportation system, but I'm a citizen of this county. That's not okay. I don't know what the answer is either, but that's not okay. It is not our responsibility to have to transport people, but it is a responsibility as a community. We help them, but it's not the county's responsibility. It is our responsibility to keep the population as a whole safe. That's why you're here today and you were here earlier this morning. There's got to be a different answer.
Thank you for your comments.
Good afternoon, Tony Barnes, Dalton Township Supervisor, 5920 Metamora Lane. I think you made the excellent decision to continue transportation for our less fortunate in our community. No different than the airport is essential personnel. I don't understand why someone driving a bus or operating a bus isn't essential personnel for our seniors. I think that showed very good leadership to make sure that our residents are being taken care of and get to these hospitals if that's what they need to do. I would like to parlay a little bit of what was done here today with respect to making a recommendation to townships and villages. But I mean, I think we, as townships, know how to govern our own townships. I think we know how. But what we want is some communication. I found out today through the grapevine that there was a conference call with some of the governor's team for all municipality leaders. We called in. It was at 3:30, so I'm driving here for this meeting and trying to call in. The call crashed. I was on the phone on hold for, I think it was 22 minutes before the phone crashed. We're not getting the information in our townships, villages, and cities. We don't have a township health department. Most of us don't have a township DPW department. We're not getting this communication, and there needs to be communication from the county level down to the cities and the townships and the villages. So I hope that communication, I think that we've established a couple lines here today through some phone calls that we've made, but I've had a lot of other townships that are relying on us for information. We're not coming here all township supervisors. They're trying to send myself as a liaison for everybody. We're not trying to inundate. We're trying to mitigate the exposure of everybody. everybody as much as we can, but we need communication. And if I need to be the point man for the rest of the townships, then so be it. But we need communication, and I hope we see that as we move forward. Thank you, and have a great day.
Thank you very much. Anyone else?
Ivan, did you get something? You got up earlier.
I've changed my mind, but sorry. Ivan Phillips, IT Director, Muskegon County. I want all the departments to know that as soon as we have that software available so that you can do call-in meetings with our WebEx, I'll let you know, okay? Because that way, when we're closed, there's still a way we can all get together and still get work done.
Can we do that too?
That's correct.
Thank you.
Can't have a public meeting.
We can't have a public
Oh,
meeting.
no. Okay. Just, I don't know what.
Any final board comments? Ken?
Just appreciate everyone's interest and concerns. We're all headed for the same thing. We all want the same outcome. Some of us have disagreements over certain issues, but the whole outcome is better public health for the entire county.
And public safety right now. Again.
Here, here.
Just one moment, please.
Madam Chair, I just wanted to thank the administrator for doing this morning. I think it was a very smart move and a very good timing on it. And thank the chairman for being there, Commissioner Larry.
Yep. Director Phillips.
That WebEx software is being offered by Cisco for free. So any other townships or villages, municipalities, cities, they can get that. And still, if they're going to close, they can also do online meetings.
And they can get hold of you.
Certainly.
And
I'll tell them who to call.
Okay, thank you. And they can, one more question while you're there. If they had a question, an IT question, could they call the help desk and somebody would answer that?
Yes, the help desk will remain open 24/7 through these next 3 weeks.
All right, thank you. Anyone else? Seeing none, we are adjourned. Everybody have a safe